Assalamu alaikum wa rahmatullahi wa barakatuh. Very good evening. Welcome to another edition of Health Matters. I'm Khawa Solomon and I'll be with you for the next hour. So please do stay with us. Stay tuned as we take your calls. And our specialist in studio will answer them. We have Dr. Shaida Umar and our dentist Shaukat Waja. That's a typical Joburg surname, I must say. Assalamu alaikum to you, sir. Welcome.
Salam.
It's a pleasure having you. And today, as we chat about dentine hypersensitivity. So this is a topic that I know when you mention ice cream, you scream, we all scream for ice cream, and yes. So if you've had experience in your family and yourself, anything to do with your teeth being sensitive, dentine hypersensitivity is the new name that we need to know, and it is widely used. So if it's something that you find does occur to you, please do stay tuned to your family, your friends, and you know of someone. We will be trying to answer your questions throughout the show. Dr. Shaukat Waja and Dr. Shaida Umar, shukran so much once again for your time. I know this very busy lady, and with everything that's been going on in South Africa, I'm sure you guys are inundated at this moment in time, but we hope that this will slow things down a little bit for you, inshallah. So yeah, let's kick off the show, Dr. Shaida Umar.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم. Just reading through a verse in the Quran and speaking about cleaning the teeth. I think the religion of Islam gives great importance to cleanness and deems cleanness as a sign of faith. Cleaning the teeth also takes place among the practices of the previous prophets. 4 things are from the practices of the prophets: the feeling of modesty, that's chastity, scent, cleaning the teeth, and marriage. Siwak and miswak, used for cleaning the teeth, also have an aspect pertaining to worship. It's a sunnah of the wudu, and according to the Shafi, a school of Islamic jurisprudence named after Imam Shafi, it's a sunnah of the salah, the prayer. In that way, every time wudu is done, or every salah time before salah, cleaning the teeth was aimed every day regularly. The merit of this action is to ensure that to ensure that there's cleanliness and that the scent of the breath would be fresh and that there would not be an offensive odor. So I think it's important to understand that this practice has not just been scientifically based, but I think from the Islamic perspective, we need to consider the value and the significance of looking after the teeth, because it's through the teeth that one can enjoy many things, enjoy the pleasures of tasting, chewing, and the different things to appreciate. And I'm going to hand over to Khawa and, of course, our very esteemed guest and expert tonight, Dr. Shaukat Waja.
So understanding 1400 years ago, we were taught that cleaning our teeth, and I'm sure there wasn't a dentist inside back then, with the regular polishing and cleaning, that miswak did the trick, alhamdulillah. But today's topic, and before we get into that, we are told that it's going to be highlighting this month and inshallah next month oral health awareness, September, October, inshallah, looking forward to that. And I know it's something that we should be doing every month of the year. But let's just talk about that and, of course, the foundation that you are founder of, Waja Kameno Trust. I hope I said that one right.
That's correct. So yes, September, October is Oral Health Awareness Month. So I think our choice of topic today is so relevant, and there's going to be a tremendous awareness, around our communities around this issue. And I think tonight, hopefully, we hope to play a role in actually highlighting some of the aspects of the topic that we have. With the Waja Kameno Trust, basically it's an organization that we started many, many years ago. Okay. But in essence, what Waja Kameno means, it means eat with teeth in Sotho. And the trust was started over about 21 years ago. And what it basically facilitates is free dental care for our differently abled kids and adults. Sure. And I'm particularly happy to be here today because if there are any people with special needs kids out there, then they become aware that they do have access to education, to dental products, to free dental care in whatever way they might need it by actually getting in touch with the Waja Kameno Trust.
Okay, and of course on your website you'll have all that information of where you guys are branching out to, inshallah, in that underprivileged areas. But let's just quickly deal with, inshallah, understanding this new term, not just sensitive teeth, but dentine hypersensitivity.
Okay.
I just wanted to say English, please.
No, I'm happy you're saying English, please, because I'd also like to just have a conversation rather than being too technical. I think when we're saying dentine hypersensitivity, what we're just doing is zoning in more and focusing more on a specific kind of sensitivity. So sensitivity is one of the areas that's challenging dentistry at the moment, but dentine hypersensitivity is a specific kind of sensitivity that's related to when our dentine becomes either exposed or compromised to the oral environment. Now, one of the most intriguing things about dentistry is the fact that we have two totally different kinds of materials in very close proximity to each other. So on the one side we have enamel, which is the white part we all see in our mouths, the hardest substance in our body, and a couple of millimeters away from there we have one of the most sensitive nerves in our body, and that's what makes you go when you're having that ice cream. And in between them is a small section that is the dentine. Now most times the enamel protects the nerve, or at least the enamel is protecting the internal environment from the outside. But when either the enamel gets compromised or there is recession, this is a key reason for the dentine hypersensitivity, is when there's a recession of the gums and the dentine now gets directly exposed on the root. That's when you get that sensitivity.
So it is actually the dentine that's being affected.
It's the dentine that's being affected.
Dr. Shaida?
Yeah, just wanting to check out. So if I heard you correctly, what you're saying, it's the inner layer
That's correct.
that becomes hypersensitive, that gets activated. And,
100% correct.
and of course that then you find this excruciating pain, this throbbing pain. But I also want to ask you, because often we find that whether it's adult or children, the pain will always start at the most inappropriate, untimely, times, like in the middle of the night when you don't have an immediate access to a dentist. And something that we find, the household remedies, and please, I'm by no means a dentist, and that's why we're asking you, that often we resort to the use of clove oil, the aspirin, grinding the aspirin. And so, those are concerns that as a medical, dental professional, perhaps you can assist us and the viewers out there on what to do.
Okay. So excellent question. The importance of the dentine hypersensitivity is that it really does affect our lifestyle, as you indicated right now. And the strange thing and the very uncomfortable thing with dentine hypersensitivity is that it catches you by surprise. So it's not necessarily that it happens at night. In fact, most time you need some form of a stimulus. It's either a thermal stimulus or a tactile stimulus or a chemical stimulus that stimulates the dentine, that then results in what is characteristically described as the sharp, short pain. That's your dentine sensitivity. So you're eating an ice cream or you're having a coffee and a tea, sitting in a wedding setting, most relaxed in a wedding setting with a couple of friends, and it hits you. And that's where that element comes in. So with regards to helping yourself at home, I certainly wouldn't advise the aspirin factor of rubbing the aspirin there. Just as a general guideline, try to avoid that at most costs, because it actually creates an aspirin burn on your gums, which actually creates a bit of damage. The clove we know historically has always worked, but nowadays we would rely more on our desensitizing toothpaste or gels that we get. And the application of that gel on that sensitive area or areas, because sometimes it can be local and sometimes it can be a little bit more generalized. So the application of that toothpaste or the gel in those areas will eliminate the discomfort
The
that you're
T-gel,
feeling.
Ashton Post, that's the only thing I can think of.
And Hawa, I'm just thinking you've identified those things, but so your gargle, like your Endolax and that, would that desensitize?
Absolutely. It would definitely play a role. You'll actually see on many of these bottles, whether it be Endolax or Corsadile, they'll actually write on them, desensitizing mouthwash.
Okay.
Because some of the products that we have in there, like glutaraldehyde and so onwards, do play a role in actually minimizing the sensitivity that we experience.
Okay, so just as a sort of fallback beside your clove, if you have, to have that mouthwash available at your home if you are sensitive to teeth, but the sensitive one. And you've mentioned I don't know, chemical
glutaraldehyde, which is one of the items that would be in these products. That's quite effective in decreasing the sensitivity.
When we get back, Dr. Shahid Omar and Shaukat Wajah, we're going to look at the condition, this actual condition, what causes it, and do we mostly find it in adults? So that's a good one to also sort of watch out for your kids and how it can possibly be prevented. We're talking about dentine hypersensitivity. Please join us with your questions after this short break. Stay with us. Assalamu alaikum wa rahmatullah. Very good evening. Welcome back. This is Health Matters, and we're talking dentine hypersensitivity with Shaukat Wajah and Dr. Shahid Omar. But remember, if you've missed any of our shows, catch it on Health Matters ITV Network's YouTube channel. Just search for ITV Networks on YouTube, and you'll find lots and lots. I think over 100 Health Matters shows. That's how far it's gone. I think we over several seasons, alhamdulillah, successfully. And remember, you make the show. So please interact with us via our office line. And we've also got an email set up. So, and the Facebook, Twitter, and comment, questions, queries, constructive criticisms all help with the structure of the show, and so does the IMA. Welcome back. Dentine hypersensitivity. We've kind of established a little bit of home remedies of just quick fixes, and also just to later on in the show we'll find out if quick fixes really does work and how we can strengthen our teeth. But first, let's start. How does this happen? How can it be avoided, and is it mostly found in adults?
Okay, so it's mainly found in adults because of the underlying cause of it. So the common age group is actually elderly people, and because of the predisposition to periodontal disease, which is one of the main causes of the dentine hypersensitivity.
Okay.
But another age group.
So you're saying you first suffer from periodontitis?
From periodontal disease.
Okay.
So remember I mentioned that one of the key factors is this gingival recession. So when we have periodontal disease, there is an infection of the gum and the underlying bone.
Okay.
So the gum and the bone actually then moves away from the tooth, and then starts exposing that root area. And that's where the dentine now becomes sensitive.
Okay.
So elderly people do have the periodontal disease, and then they'll have that sensitivity. But another age band is between 20 and 40. And now let me scare you ladies, it's more prevalent in ladies than what it is in men.
And possibly in more pregnant women, because I'm thinking often when I was pregnant, they would say, you gain a child, lose a tooth.
That's
so
correct,
then it just becomes weaker, this area.
Yes. So there's various hormonal changes taking place in your body. You're more prone to gum infections at that point in time.
Okay.
There's loss of calcium and so on. So you do become a bit compromised orally during your pregnancy. But definitely under today's circumstances, no need to lose a tooth.
Okay. But the big question, can it be avoided?
Can be avoided. If I may just take one step back and just complete the reasons why you get the dentine sensitivity, right? A hypersensitivity. So the one is the gum recession, but there are various other reasons as well, all relevant in what we see in our practice on a daily basis. So the other one is what we call abrasions, right? Now, abrasions is where you have the sort of a wear pattern on the side of the tooth. And the wear pattern is many times caused by vigorous brushing.
Oh.
Now, this is now what we bring on to ourselves. So we actually bring on the dentine hypersensitivity by incorrect brushing techniques or too vigorous brushing in a particular area. And that wears away the gum and exposes the dentine, makes you more sensitive in those areas. Other factors are things like attrition, right? Now, attrition is where we actually wear away the enamel surfaces of our teeth. And so the insulation that we spoke about earlier now gets less and less. Now, elements that would bring about that attrition would be very commonly what is now called bruxing. Now, bruxing, many weeks ago, the Sunday Times actually had a paper called Life is Such a Grind. So because of our stressful lives, we unwittingly, subconsciously start clenching on our teeth, grinding on our teeth, and that wears away the enamel surfaces and then exposes us to this dentine
I heard some people do that
hypersensitivity.
in their sleep as well. But Dr. Shaida, your interesting comments on this and take on
Okay,
it.
so I think just picking up on that and what Dr. Shaukat mentioned earlier about lifestyle, and I think just looking at the lifestyle challenges that often people are faced with, because this grinding of the teeth is also attributed to daily stresses.
Yeah, it's psychological,
and
I'm sure.
somatizing as a result of that. And I want to ask Dr. Shaukat that often we find where patients have gone to dentists, have gone through rigorous examinations, the x-rays, etc., and there's no diagnosis or known cause to explain that excruciating pain. Perhaps you can respond to that.
Yes. So, now you're alluding to what can be quite a challenging arena in the dental examination room, because a patient comes in, patient tells you she's in pain, and we go through various tests, right? From the consultation to x-rays to different tests, vitality tests that we do, and the tooth does appear to be okay, but the patient is saying that she's experiencing some discomfort or he's experiencing some discomfort.
Okay.
Then we have to extend the field of concern. So we would then start looking at what we call myofascial pain. It's really a very serious factor. We've actually had people saying they feel like knocking their head against a wall, and they're in so much pain, and they're coming to us, and we would say, no, but there's nothing wrong with your tooth. So then you go into a more complex arena. You then have to look at areas like the temporomandibular joint, right, which is also can contribute to quite a bit of discomfort in area. And then you've got to look further afield to the nerve area, like neuralgias and trigeminal neuralgias and those kind of areas. And I must share with you, it can get quite complex. So you're going to one specialist after the next specialist,
That's right, yes.
and they have to then try and ascertain. And many times it's actually a process of exclusions, where they will eliminate, okay, it's not this, so let's look at that. It might not be that, let's look at the next one. And inshallah, they then come up with something
I've heard
that can
actually,
assist
now
you.
that you're mentioning, I've actually had some of some extreme cases that it's gone on for years just to find a solution.
Yes.
So inshallah, for those that are suffering, we do have a dentist in studio if you've got any conditions related to dentine hypersensitivity, but the focus is Oral Awareness Month. We're doing it both September and October, inshallah. So any questions of how to brush, we've got a lovely actual artificial mouth in front of us here, and we'll ask Doctor to get into that to tell us how to brush our teeth as well. But quickly before we do that, because often we get told as children, brush your teeth for 2 minutes, brush around, don't brush straight, don't brush too hard, but we don't really get to it properly. And we are sort of active, demonstrative people. We want to see what's going on. So doctor's going to demonstrate to us. But quickly, what is the difference between sensitive teeth and dentine hypersensitivity? Is there a difference?
There is a slight difference. So sensitive teeth is a more broader arena, right? Where people will feel that the teeth are a bit sensitive, and they're not sure where the sensitivity is, but the teeth are a bit sensitive. It's also linked to the fact that we have these dentinal tubules that are open, if I might just say it sort of
Coming through
commonly.
the enamel.
So I always tell people, if you imagine like how we've got pores on our skin, you've got these little tubules that are running through your dentine from the one side to the nerve on the other side. And when they are open, sometimes you can have what is a perfectly good looking white tooth, and that person's experiencing sensitivity on that particular tooth. But dentine hypersensitivity is a little bit more painful, a little bit more localized, and that is what differentiates the dentine hypersensitivity from a general
So
sensitive.
it's an extreme pain.
It's an extreme pain. It's a sharp pain. It's a short, sharp pain. In fact, it's one of the differentiating factors. When we have those pains that arise, say, at night that you mentioned earlier, those pains tend to linger on a bit. What makes dentine hypersensitivity a little bit difficult is that it's a bit subjective. You've got to talk about it for a while to work out exactly what the patient is experiencing.
Because you can't see it.
And many times it's linked to the fact that you have to eliminate other causes to come to the realization that it's actually dentine hypersensitivity.
I'm just wondering if I can just interject quickly. You've raised something so important. We said that the pain, the short, sharp pain sometimes will surface at night, but it's not that it's surfacing at night. I think sometimes it's actually there during the course of the day, that chronic pain, but during the day one is more distracted with other
That's correct.
activities.
That's correct. Yeah.
So although the pain is there, it's kind of forgotten or it's parked. But at night, everything is focused on resting. And of course, that pain then becomes heightened.
So would you say, Dr. Umar, that it's somewhat psychological as well, because now you've been distracted by this pain. It is there, but now you are more relaxed, you're casual, and all of a sudden you feel it. So is it something that it is there? If you've been diagnosed with it, it's actually there. But I mean, there's the difference, as we mentioned, the sensitive and a dentine hypersensitivity could also, maybe just be a little bit of a sensitive tooth and not necessarily dentine.
But I think, you alluded to psychological.
Yeah.
I think it's real, but it's just more compounded when all the sensory modalities are in a state of relaxation, and that is what one needs to take cognizance of.
So do we put ourselves through that sort of instance of taking our mind away from that very heavy pain, that it is possibly there during the day when we are busy? Now we are relaxed, we feel it, so we grab a painkiller or, that mouthwash.
Yes.
So could we possibly help ourselves with something more holistic through the pain?
Yeah, if you talk about more holistic, I think there's various predisposition factors.
Okay.
One of them is the diet that we're having. So in terms of helping ourselves, we've got to manage the diet that we're having. So for example, a very acidic diet will contribute to this dentine hypersensitivity. So if even during the course of the day, you're going about your day-to-day activities, but if you manage your diet, you can actually protect yourself from these kind of stuff.
Brilliant points.
Elements like your cold drinks, right? All these lovely pastries
the
we're
gassy.
having, all these lovely things we're having, actually will predispose you to the dentine hypersensitivity.
Okay, so we want to touch on more of a healthy diet and what can influence the reasons we are losing that enamel, some of the symptoms, and how exactly it does get diagnosed after the short break. Please do stay with us. We are taking your calls. Apologies for those that are calling us and the line getting dropped. We're just trying to get through, this whole very interesting topic. But please do stay on the line. If you are calling in with your questions, please partake, interact. We want to get through to your questions so we may answer them and be of some sort of help through this dentine hypersensitivity show. Back in a moment. Assalamu alaikum and welcome back. Dentine hypersensitivity is our topic for today as we highlight oral health awareness for September and October. We have dentist Shaukat Waja and in studio Dr. Shaida Umar, and we looked at the symptoms being the sharp pain, the very painful feeling you have in your teeth. Just quickly looking at where in the mouth is it found and how do you exactly diagnose it?
Okay, so the common areas where it's found is mainly along sort of the canines and the premolar areas, and that's linked to the method in we brush in those areas sometimes, right? The incisors, the lower incisors, obviously commonly people say I put on ice cream or something, they feel that as well. That's mainly linked to the fact that those lower incisors are actually very small teeth.
Maybe you can just show us on the teeth, the lower incisors.
Yes. So
okay, there we go.
Well,
there's also a picture.
Those are the molars.
Those are the molars.
The red ones are the molars, and the ones right in the front of the mouth, the lower ones, those right in the front, those are the incisors, yeah.
At the bottom.
At the bottom.
Okay.
As you can see how small they are. So temperatures are very easily transmitted to them. If they've lost some of that protective enamel covering, then they're bound to feel quite sensitive as well.
And those are also sometimes places when you're standing in front of the mirror and you're brushing your teeth and you're just doing this vigorous from the side and you're just moving up and down on the side of your mouth because you're lost in thought.
Yes,
so you do excess brushing there maybe.
That's correct. That's correct.
I think that's such an important point you're raising, Hawa, because often we feel, even as adults and even with our children, so maybe they've had too much sweet stuff or acidic stuff to eat, and what is the immediate response or the knee-jerk reaction is let's clean all the dirt and grime out, get all the muck out of your teeth, so the vigorous brushing. And I think I want Dr. Shaukat to respond to that because that is what we do all the time. And are we doing more harm or good to the teeth.
Very true, Dr. Mart, because when you're done eating, you have this furry feeling on your teeth, and then you feel like it's very dirty, and you need to do that extra brushing, as Dr. Mart mentioned.
Yeah, it's an absolutely natural response. You know, you've had, especially in particularly, she mentioned the very acidic food, so we want to go and we want to brush.
Yeah.
So two elements. After you've had very acidic food, do not go and brush your teeth immediately after, because what you're doing is you've got all of this acid on your teeth now, and you then use your toothbrush to actually further spread that acid in and around the other teeth as well. So what they generally advocate is to rather rinse your mouth at that particular point in time, rinse your mouth out thoroughly, and then brush your teeth a little bit later after that. Right? The second aspect of the vigorous brushing is also one that we must eliminate. So the purpose of brushing in essence is the removal of plaque. And plaque is actually defined as a soft white substance. So when we brush vigorously, we actually potentially causing damage to our teeth by wearing away the enamel on the teeth by this vigorous brushing. So you want to have the correct pattern of brushing, and you want to be gentle. I always tell people, don't go to gym on your teeth, you know. Just soft, gentle massaging motions, firm but not too hard. And obviously a key thing that we stress to people all the time is not to use a hard bristled toothbrush.
Okay, let's have a look if you could show us with your mouth available here.
All right, so this is a little mouth that we've got over here.
Okay.
I've deliberately left the lower teeth out so people can see what it looks like when you lose those teeth.
Are they often lost though?
They are lost. You know, a key thing we tell people, only brush the teeth that you want to keep.
Yes.
Because once you don't want to keep, don't brush. You'll definitely lose them. So one of the brushing techniques, I'm just going to simplify it, but there's various brushing techniques, but a very popular one is what we call the circular scrub method. So this is when we use our toothbrush in a circular motion. The key element is to angulate the bristles of your brush 45 degrees to your gum.
Okay.
And then use small circular motions.
So just turning it slightly,
45 degrees upwards. If you come into the lower teeth, then 45 degrees towards your lower gum.
Okay.
And the purpose of that is to enable good cleaning along that gum line there. And in a circular motion that way. Another component or another technique that we use is what you call a vertical brush method, this way there, where we actually brush downwards. So this has sort of been combined, whereby if you're brushing in a circular motion, when you're doing the downward stroke, have a sort of a brushing stroke downwards so that you brush your gum downwards, but you also clean out these little interproximal areas between your teeth and keep those teeth neat and nice.
Okay, and between the gum and the tooth.
Between the gum and the tooth. But what we advise against is this vigorous back and forth kind of brushing, because that's where you create those toothbrush abrasions. And automatically we feel we've cleaned well when we've done that. Also remember to brush
what are you doing to your teeth, seeing that you just showed that very vigorous? When you are doing that,
what you actually do, this gum just above the tooth is a very sensitive and a very thin gum along that area. And when you do that, what you're in essence doing is wearing that gum away. And you then start exposing the root.
Yes.
Right? So a circular brushing motion or this vertical downward motion, we have to brush the outer area, and then we've got to brush the inner area on our palatal side or our tongue side, and then we've got to brush on these occlusal surfaces where we actually eat on.
The edges,
The edges. So right where you eat on, that's very, very crucial, that area over there. Right? Teeth get holes basically in two areas. The one area is in these crevices, so you've got to brush in that area, and the second area where teeth get holes is in between the teeth. And now we come to a very important element, which is the flossing of the teeth. And this is the part many people don't want to hear about. But to scare you, flossing takes care of about 25% of plaque in your mouth.
Sure.
So if you're not flossing, be aware that you are leaving 25% of plaque in your mouth. There's various different methods these days to help you to take care of that. So you've got a floss, the conventional floss, you've got different kinds of floss. Nowadays you even have something called a water floss or an aqua floss.
Oh yes, I
and
think
this is a little item that you can use to spray water
cool.
between your teeth to clean out that area. Or you've got these little interproximal brushes that you can use obviously very, very gently to clean out in between the teeth, and in that manner keep the teeth nice and healthy.
I'm burning to ask this question because I think so many people out there are affected by this. People who are bulimic, who eat and then purge, so suffering from eating disorders, and the effects it leaves or how it harms the teeth. I think if we can speak to that, but also the issue around reflux and how that could also be harmful. So perhaps you can just elaborate on that, please.
Such an important question. Right? These are some of the issues that just go past people, but this is an area where dentists can play such an important role.
Okay.
Many times a dentist is a person who diagnoses that even before the doctor does. So the patient comes in, you look at the patient's mouth and you then start asking questions, and you can actually then guide the patient in the right direction to go see the doctor. But the effect of those elements, the reflux and the bulimia and so on your teeth, is quite destructive. So what happens, we create we actually many times regurgitate a very acidic kind of a fluid in our mouth, and we create this erosive pattern. So this is the other cause of dentine hypersensitivity. So what you mentioned is a direct cause of what we're talking about. So it erodes these teeth in a particular fashion. I mean, when you look at it as a dentist, you can recognize, listen, this is most probably acid reflux or bulimia or something, and it almost what we call sort of a crown prep kind of a thing. When you look at the teeth, it looks as if teeth have been prepped by someone.
And it's literally burning away the
enamel. And then the protective layer is gone, and then they start getting these sensitive teeth and so on.
Okay.
Now, to treat those patients, obviously a lot more complicated than to just treat the teeth, because you've got to treat the underlying issue.
Looking at the diagnosis of this and knowing the symptoms, that being one condition, the excessive brushing being another one, what is the process of diagnosis?
Okay, so also a very good question. Ideally, what you want to do is you want to go to your local dentist, and he'll have to go to a series of steps, right, to come up to the diagnosis that this is dentine hypersensitivity. Starting straight, early on in the consultation, in asking you questions, when you're getting the pain, how often you're getting the pain, and so onwards. Then actually coming down to the examination of your teeth, right? Sometimes these lesions are easily visible. Okay. We almost appear to be magicians, because the patient can't see where it is, and you look in the mouth and you can see exactly when you put a bit of air, then poof, the guy jumps. That's it, doctor. So sometimes it's clearly visible, other times not. Then he might have to do various tests. There's little percussion tests that he'll test the teeth, how the teeth are responding. He'll do a bit of a sensitivity test with a bit of air or a bit of water. He'll take an X-ray to see where it is. He might ask the patient to bite on certain things to eliminate the possibility of a fractured tooth. So once he's gone through those various tests, he will then guide you for whether it is actually dentine hypersensitivity or whether there is actually another issue that needs to be seen to.
Okay. Dr. Mahdi, you've mentioned the very, excessive brushing and the type of, manners of using your toothbrush, and you've explained beautifully. But still, we have this manner of, for years and years and years, that is how we are brushing our teeth. How can we sort of manipulate that thinking in starting to brush and have a good, dental routine?
Well, I think we've got so many opportunities these days, and I think just going into some of the doctors' rooms, even dentists' rooms, we find that they have video recordings, creating awareness, and a lot of dental hygiene awareness at school, starting at preschool. And I think that is where the catchment area is. We need to start with children very young. Yes, we educate the adults as significant others, but I think we need to work with both children and adults, so a more holistic approach to ensuring that children are taught, but they're also given an opportunity to role play, rehearse what they've been taught. And I know that you've indicated that there are some awareness programs, or that you have dental programs annually, but I know like people like Colgate, and I'm not a proponent of any brand name here, but they go out to schools.
They do.
And they teach children.
They do.
If I might just add, so caries, dental caries is the most common disease prevalent today.
Okay, I've never heard of caries.
Dental caries is when you turn a frotus.
Yeah, rot.
Right?
Okay.
Decay teeth. It's the most prevalent.
Basically black.
Yes. So it's really something that we need to focus on.
Okay.
And the strange thing is really something that we are actually capable of controlling. So especially in our society today, we should be striving that our kids grow up without any cavities. Because such is a dental field that if you focus on it, if you get the basics right, we can all basically go through life without a cavity.
Yeah.
That's really the aim.
I know, and that is why I've directed, to Dr. Omar to sort of help us manipulate our brain to think differently, because when you're still brushing your teeth and you have that very old ways of brushing from side to side, you have to actually stop and think, okay, well, I'm doing wrong. You have to physically and psychologically look subconsciously everything. You have to just make yourself stop to do the right thing and make the right
She's
movements.
actually on a good point, because we find it quite strange in the dental field. Like we would be having a patient, say for maybe 5 years, 6 years, and on each occasion that the patient comes for the cleaning, we would reconfirm with them, listen, this is the technique.
Yeah.
And strangely enough, many times the patient re-looks at you on each occasion with absolute surprise.
Yes, like you didn't
With
say it the
surprise,
last
like you
time.
didn't say it the last time. That kind of a
Yeah.
thing.
So
it's-
working
it's-
with children,
yeah.
I think what we find works is
Yeah.
about repeating. It's
Okay.
reinforcing that information. Anything you teach a child, you've got to ensure that the conveyor of the message and the recipient of that
Together,
message has
yeah.
understood it and repeat it and rehearse and role play to ensure that that information is fully understood.
Yeah.
And once it's understood, it can be integrated and implemented.
Absolutely. So we are taking your calls and sort of understand that, it isn't, we've been doing it for years and years, the way you've been brushing your teeth. So let's just rethink of how you're going to brush your teeth tonight and tomorrow morning. More of dentin hypersensitivity after this. Assalamu alaikum and welcome back. This is Health Matters. I'm Khawa Solomon, with me Dr. Shaida Omar and Dr. Shaukat Waja, our local dentist in studio, talking to us about oral health awareness happening September, October, and hopefully for the rest of the year, inshallah, we're talking about how we need to brush our teeth, how we must brush our teeth. But another thing on brushing our teeth is the type of toothbrush. Could we just touch on that, and how exactly do you floss? Because you get the flossing, the floss that you can put in your hands, and then you get the little flosses in the holder.
Yes.
What would be most appropriate?
All right. If we start with toothbrush first, right? So your selection of toothbrush is highly, highly important. Choose a good quality toothbrush, one that works for you. One of the first questions that always arises, whether you go for an electric toothbrush or whether you go for a manual toothbrush,
Okay.
right? So if you're going for an electric toothbrush, there's so much technology that's now introduced to the electronic toothbrush that it does bring a lot of advantages to the whole process. Right down to even counting how many calories you've lost while you're brushing your teeth, how many minutes you're
Your arms.
brushing, all those kind of things. But if a manual toothbrush works for you, then it's fine.
Okay.
But then select the right toothbrush. You don't want to take a head that's too big, because you want to be able to reach comfortably to all of the spaces, especially to the back of your mouth. We have a different arrangements of the filaments in the toothbrush now. So you want to find some of them are crisscrossing, some of them are straight, and you got to try a variety of toothbrushes to actually find ones that work, and you'll be surprised how different ones work for you. So, that's where you start. Try different toothbrushes and see what's work. But go for some of the basic things is that use a soft bristle toothbrush.
Okay.
Another key thing is use
I didn't know you get those, until I
Yeah.
was advised to go and look out for them.
There is some excellent brands, right? We're not going to mention names necessarily, but there are beyond our conventional Colgates and that kind of stuff. So these are imported products, right?
Okay.
That are excellent toothbrushes. They might cost a little bit more, but they're really, really good. Then, when it comes to your, the one thing I want to mention, toothbrushes must be disposed after 3 months.
I'm so
Okay.
glad you said that.
Right? So,
So-
that's a key thing. And please don't share toothbrushes.
And changing toothbrushes?
Approximately after 3 months.
3 months.
After
okay.
3 months, yeah.
The difference between brushing with, because alhamdulillah we have this knowledge about the miswak,
Yes.
to the rest of the viewers, the difference between brushing with the miswak and toothbrush and toothpaste.
Yeah. So look, the benefits of the miswak we all know, right? It's excellent. With modern day technology and what's available to us, today we advocate using both of them.
Okay.
So there are moments when you'll use your miswak. She mentioned earlier on, the Prophet ﷺ stressed the brushing of teeth. He said if he didn't think it was, this is narrated hadith,
Yeah.
if he didn't think that it would be an inconvenience to his community, he he would have made it obligatory to brush your teeth before every salah.
Yeah, that's
Right?
beautiful.
But that's what happens. So you can use your miswak, and then you find your moments where you use your toothbrush.
Okay.
The flossing is so critical. Unfortunately, I didn't bring some floss with, but it is a bit cumbersome to do. But when I
Yes.
share with people, once you get used to it, and you get used to how clean your mouth feels after you floss, you cannot live
Absolutely.
without flossing.
I've also discovered those little ones that you get almost look like a toothpick.
Yes.
And when using that, it's something
Yeah.
you can use throughout the day
Yes.
without even brushing.
Absolutely. Key thing again, do not hurt your gum.
Your gum,
Do
okay.
not hurt your gum. Many times we feel we've cleaned well when we've pressed on it and we've
Yes.
made it bleed a bit.
Yes, yes.
But not on your gum, it's for
do
your
not
teeth,
hurt
eh?
your gum. It's
Yes.
just gently, you move down the sides, and we always talk about a sawing motion. So don't push the floss down. Go through between your teeth in a back and forth motion.
Okay.
Back and forth
Okay.
motion, then sideways to the one side, sideways to the other side, and you come up again. But don't hurt your gum.
Okay.
Dr. Shaukat, I'm dying to ask you this question. Our eating patterns, our eating habits, and how does it influence the health of the teeth and the gums? How does it actually impact on that? Because often we think that eating sweets and chocolates, all the junk foods are, stay away from, no good for your teeth. But I think there's more to it than that.
I'm going to come to that question now. I just want to mention one thing that's going through my mind. So when they ask cardiologists and all these big doctors what you'd have to do to look after your heart properly, in the top 3 would be flossing. In the top 3, in terms
flossing
of
is real flossing.
As in real flossing. So when we have infection in our mouth, right, we negatively
Interesting.
impact on our general health in a big way. Now, once we get this out to the community, we've had a successful
Yes,
program.
yes, inshallah.
So what happens
Flossing.
is that when we've got infection in our mouth, we cause or we contribute to a septicemia in our blood system, which makes us more prone to heart infections. It makes us more prone to sugar diabetes. It makes us more
Didn't
prone
know
to
that.
Alzheimer's disease. If you're going to have a baby, right, it directly impacts on the term of delivery of your baby,
Wow.
a low weight baby, all of those elements. So I'm just mentioning it quickly because the opportunity arose.
Yes,
on
no,
that,
so
on that
flossing
particular
should
thing.
be a fardal thing.
It's a fardal thing.
Alhamdulillah, I think
Yeah.
we all have to go
Now
back
we have
and
to get some
do it
flossing.
diligently.
Coming now to
Wholesale.
the food element, right? Excellent question again. So we would normally, say to people, listen, don't drink a lot of cold drinks and
Yes,
don't
and
eat a lot of
gassy, yeah.
sweets and that kind of stuff, because those we know are directly acidic elements with negative impacts. But when we're talking about an acidic diet, it gets a little bit more complex than that. And there are actually certain items that contribute to an acidic diet, and we might not even take those things into account. So easy things, there are certain things like lemons, right, that certain people suck on.
Yes, my
Right?
son does.
So
actually.
they suck on lemons, and that it creates a very acidic, direct
Yes,
acidic
yes.
impact.
On your tooth.
Tomatoes, right, have got
Okay.
a very acidic.
Can I just quickly take that call?
Sure.
Tomatoes, lemons. Let's take our call. This is Health Matters. Assalamu alaikum.
Walaikum salam.
Your question to the dentist.
Okay, man, I don't know. I just tuned in a little while ago.
Okay.
I wanted to know on the dental floss,
Yes.
how will you know which one is halal and can you just do
Okay.
it by anyone?
Okay. Would you have a question for the caller? We'll be able to answer.
An answer.
Sorry, yeah. Shukran so
Yeah.
much for your call. You can listen on screen. So halal, do you get halal, non-halal?
Yeah, I think there is certain concerns and considerations depending on how the floss is manufactured and so
Okay.
onwards. And I think the caller must just do a little bit of an investigation, like with one of our Muslim organizations and so
Okay.
onwards, Sana and so onwards, that would direct her to which flosses are okay
Available.
and which are not
Halal.
okay.
Shukran,
Yeah.
that's a
Sharia
good question.
compliant.
Sharia compliant.
Okay, so lemons and tomatoes. So trying to stay away from those
So
foods.
other contributing factors, other elements that make up an acidic diet would be elements like meat, right?
Okay.
Eggs, right? Beans, legumes, right? All our manufactured polonies and those kind of
Okay.
stuff.
Processed
Processed foods,
foods,
right?
yeah.
All contribute towards an acidic diet. So obviously it becomes a complex field that we're dealing with now.
Yeah.
But a key element, I think, is this concept that it's so well accepted in Islam, and that is moderation.
So, Dr. Umar, we need to
controlling.
wrap up, and there has been some questions about fluoride prevention. Maybe we'll have a follow-up show. How often you've got to mention in conclusion, how often you have to visit the dentist. But your last comments for tonight's show.
My last comments is visit your dentist. Don't treat yourself. Ensure that you go and see your dentist, because dental care is key to all healthcare, as has been
And start flossing.
shared with us today.
All the time. Okay, so Dr. Shaukat Wajah, quickly tell us about the projects that Wajah Kameno Trust does, where they reach out to, and then also how often we should be visiting you.
Okay, so quickly, to visit your, the time period to visit your dentist is twice a year, every 6 months. I don't know who came up with that idea, but that guy was a brilliant guy, because it really works. We can see after 6 months that there is a need.
Okay.
With the dental health month being here now, the Wajah Kameno Trust has its annual dental fun day.
Okay.
Right? It's a special day for our differently able kids. We have approximately 800 kids that come from various different schools to a small holding in Aikenhof, where we treat these kids to the end of the world and back. But it's all done with the dental theme. If there are any listeners out there that have got special needs people at home, they must please feel free to get in touch with us. We can invite them to the particular function, and then they can have a good day with us.
It was a brilliant show.
Alhamdulillah.
Health awareness. Yeah. Let's make oral flossing. Let's make oral flossing a wajibat. But shukran so much for your time. It's been an absolute pleasure, and all the best with the Trust, the Foundation.
Thanks for having me.
It's a pleasure, and we'll see you soon, Dr. Umar,
Inshallah.
for your time. We appreciate it. There we have it. Oral Awareness Months going up from September and October. Please be part of it. And also you can Google Wajah Kameno Trust, and you can find all the information they have there. Be part of it and also help those underprivileged. Floss, floss, floss. For myself, wassalamu alaikum, and goodbye for now.